Ever wondered about the effects of Ozempic? Welcome to our deep dive into this fascinating medication. Ozempic, also known by its generic name semaglutide, has been making waves in the world of health and wellness, particularly for its role in managing type 2 diabetes and aiding in weight loss. This medication comes in various strengths, each with its own specific dosage, making it a versatile choice for many individuals. But how exactly is Ozempic used, and what are the things we need to know before starting on it? Over the next hour, we'll be breaking down everything you need to know about Ozempic, from its strengths and dosages to how to use it, common side effects, drug interactions, and even the latest research. So if you're considering Ozempic or simply curious about its effects, you're in the right place. Stay tuned as we cover its strengths, dosages, how to use it, and much more. Ozempic is available in several strengths and dosages, each tailored to meet individual needs and treatment goals. This medication comes in pre-filled single-use injection pens, and strengths include 0.25 milligrams, 0.5 milligrams, and 1 milligram. Starting off, healthcare providers usually recommend the lowest dosage, the 0.25 milligram pen, to allow the body to adjust to the medication gradually. This dosage also helps to minimize the initial side effects that some individuals may experience. After 4 weeks, your healthcare provider may increase the dosage to 0.5 milligrams, depending on your body's response to the medication. The increase in dosage is aimed at enhancing the treatment's effectiveness, especially in controlling blood sugar levels and aiding weight loss. In some cases, the dosage may be further increased to 1 milligram if the desired therapeutic effect isn't achieved with the 0.5 milligram dosage. However, any adjustments to the dosage should always be under the guidance of a healthcare provider. It's important to remember that increasing the dosage doesn't necessarily mean better outcomes. It's all about finding the right balance that works best for you and your body. It's also worth noting that while Ozempic comes in different strengths, it doesn't mean it's suitable for everyone. Some people may experience side effects or may not achieve their desired results with this medication. Therefore, it's important to have ongoing discussions with your healthcare provider about your experiences, concerns, and progress while on this medication. In conclusion, Ozempic's strength and dosage flexibility offer a promising approach to managing type 2 diabetes and facilitating weight loss. It's typically started at a lower dose and may be adjusted based on your treatment goals and how you respond to the medication. However, as with any medication, it's crucial to follow your healthcare provider's advice and instructions to ensure the safest and most effective use of Ozempic. Administering Ozempic is done once a week via subcutaneous injection. This method of administration is surprisingly straightforward and can be done in the comfort of your own home. It's not as daunting as it sounds, I promise. The medication is housed in a pre-filled, single-use injection pen designed for ease of use. The first step is to prepare the pen. After removing it from the refrigerator, allow the pen to sit at room temperature for about 15 minutes before using it. This helps reduce any potential discomfort during injection. Next, you'll want to choose an injection site. Ozempic can be injected into the abdomen, thigh, or upper arm. It's best to select a site that's easy for you to reach and see. Avoid areas with scars, moles, or skin that's tender, bruised, red, or hard. Before injecting, clean the selected area with an alcohol swab and let it air dry. This helps to reduce the risk of infection. Then remove the cap from the pen and make sure the needle is secure. To inject the medication, pinch a fold of skin at your injection site. Insert the needle at a 90-degree angle and push the dose button until it can't go any further. Hold the button and count slowly to 10 to make sure you've delivered the full dose. After releasing the dose button, remove the needle from your skin. Dispose of the used needle in a sharps container to ensure safe disposal. Remember, never share your injection pen or needles with others, even if the needle has been changed. One crucial aspect to remember is to rotate your injection site each week. This means you shouldn't inject in the same spot each time. Rotating sites helps to minimize the risk of developing lumps or skin changes and helps to avoid discomfort. So there you have it. The administration process for Ozempic may seem a bit complex at first, but with a bit of practice it becomes second nature. It's important to rotate the injection site each week to avoid discomfort. While Ozempic is effective, it comes with potential side effects. As with any medication, the body may react differently as it adjusts to the new substance. The most common side effects are often related to the digestive system. These include nausea, vomiting, diarrhea, stomach pain, and constipation. Nausea in particular is commonly experienced when first starting Ozempic. It's a sensation of unease and discomfort in the upper stomach with an involuntary urge to vomit. This may be accompanied by a general feeling of being unwell, also known as malaise. Vomiting may also occur, which is the forceful expulsion of stomach contents through the mouth. Diarrhea or loose watery stools is another common side effect. Alongside this, some individuals may experience stomach pain, a discomforting sensation in the abdominal area. Lastly, constipation, characterized by infrequent bowel movements or difficulty in passing stools, is another possible side effect. It's important to note that these side effects are often temporary and tend to decrease over time as the body adjusts to the medication. However, if they persist or become severe, it's advised to seek medical attention promptly. In addition to these, there may be less common side effects such as changes in appetite, fatigue, dizziness, or skin reactions at the injection site. It's crucial to stay observant and report any unusual changes to your healthcare provider. While the list of side effects may sound daunting, remember that Ozempic has been approved by health authorities because its benefits outweigh the potential risks for most people. Many individuals using this medication do not experience serious side effects. It's also worth noting that managing side effects can be as simple as adjusting the dosage or the timing of the injection, which should always be done in consultation with a healthcare provider. To summarize, while Ozempic can cause side effects, most of them are manageable and decrease over time as your body adjusts to the medication. Ozempic can interact with other medications, so it's absolutely essential to be transparent with your healthcare provider about any and all medications you're currently taking. This includes prescription drugs, over-the-counter medications, vitamins, and herbal supplements. Why is this so important? Well, drug interactions occur when a medication interacts with another substance, changing the way one or both of the substances work in the body. This can increase the risk of side effects, decrease the effectiveness of the medication, or even cause a completely new effect. One specific interaction to be aware of is between Ozempic and insulin. Both of these medications lower blood sugar levels, so taking them together could potentially lead to hyperglycemia or low blood sugar. Symptoms of hyperglycemia can include dizziness, confusion, shakiness, and in severe cases, unconsciousness. If you're prescribed both Ozempic and insulin, your healthcare provider will likely monitor your blood sugar levels closely to prevent this from occurring. Another potential interaction is between Ozempic and sulfonylureas, a class of medications also used to treat type 2 diabetes. Like insulin, sulfonylureas lower blood sugar levels, so taking them together with Ozempic could also increase the risk of hyperglycemia. It's worth noting that these are not the only potential interactions with Ozempic. Other medications could also interact with Ozempic, which is why it's so crucial to keep your healthcare provider informed about all the substances you're taking. In some cases, your healthcare provider may decide to adjust the dosage of Ozempic or the other medication to prevent interactions. In other cases, they may monitor you more closely to catch and manage any potential interactions early. Remember, your safety and well-being are the top priorities, so don't hesitate to ask questions and provide your healthcare provider with as much information as possible. Significant interactions may occur with insulin or sulfonylureas, requiring careful monitoring. Patients often wonder how quickly they'll see the effects of Ozempic. Just like any other medication, the effectiveness timeline of Ozempic varies from person to person, based on individual factors such as the severity of your condition, your lifestyle, and how your body responds to treatment. However, there is a general timeline that most patients follow. In the initial weeks of using Ozempic, you may not notice any immediate changes. This doesn't mean the medication isn't working. On the contrary, Ozempic is subtly starting to do its job in your body. You may begin to see improvements in your blood sugar levels within the first few weeks. This is the primary purpose of Ozempic, to help control and regulate blood sugar levels in those with type 2 diabetes. As the weeks pass, you might notice you're feeling better overall. This is because your body is gradually adjusting to the medication and your blood sugar levels are becoming more stable. It's important to know that managing blood sugar levels is a key part of managing weight as well. Now, when it comes to weight loss, the timeline extends a bit further. While Ozempic can help with weight management, it's not an overnight solution. More significant effects on weight loss tend to occur over several months of consistent use. This is when you may start to see a noticeable reduction in weight. Remember, Weight loss with Ozempic is most effective when used in combination with a healthy diet and regular physical activity. So, to sum it up, Ozempic starts working in your body from day one, but the visible effects like improved blood sugar levels can be seen within a few weeks, and more noticeable weight loss can be seen over several months. It's a gradual process, but the benefits are worth the time and patience. Always remember to discuss any concerns or questions with your healthcare provider. They can provide the most accurate information based on your individual health situation. More significant effects on weight loss occur over several months. Concerning long-term safety, ongoing studies continue to evaluate the effects of prolonged use of Ozempic. As we navigate the realm of chronic disease management, the question of long-term safety of medications is paramount. Let's dive into what we currently understand about the long-term safety of Ozempic. Ozempic, like any medication, is not without its risks. While the most common side effects are gastrointestinal in nature, rare but serious side effects can occur. These include pancreatitis, changes in vision, kidney problems, and diabetic retinopathy. However, these risks are relatively low and are often outweighed by the benefits of improved blood sugar control and weight loss. In terms of long-term safety, studies have shown that Ozempic is generally safe for prolonged use. A 2-year study found that Ozempic continued to maintain its efficacy in blood sugar control and weight loss, with no new safety concerns arising. However, as with any medication, the long-term safety profile of Ozempic is continually being evaluated through post-marketing surveillance and ongoing clinical trials. It's important to note that every individual is unique, and the way one person responds to a medication may not be the same as another. This is why ongoing monitoring by a healthcare provider is critical. Regular checkups allow for the early detection of any potential issues and enable timely adjustments to the treatment plan if needed. Furthermore, maintaining a healthy lifestyle alongside medication use is a key part of managing type 2 diabetes and promoting overall health. This includes regular physical activity, a balanced diet, and good sleep hygiene. These lifestyle factors can help to mitigate potential long-term risks associated with medication use. In conclusion, the current understanding is that Ozempic is safe for long-term use in managing type 2 diabetes. However, it's essential to continue regular monitoring with a healthcare provider to ensure the medication continues to be safe and effective for you. While it's shown to be safe for long-term use in managing diabetes, ongoing monitoring by a healthcare provider is recommended. The coverage of Ozempic by insurance varies. It's a reality that many medications, while necessary for our health, can sometimes put a dent in our wallets. That's why it's important to understand how insurance plays a role in covering the costs of drugs like Ozempic. Most insurance providers, including Medicare and Medicaid, do cover Ozempic under their prescription drug plans. However, the extent of coverage can differ greatly depending on your specific insurance plan. Some plans may cover the full cost, while others may only cover a portion, leaving you with a copay. Your copay, if you have one, is the amount you're required to pay out of pocket when you pick up your prescription. This amount can vary and is determined by your insurance plan. Some people may have copays as low as a few dollars, while others may have copays that run into the hundreds. It's also worth noting that your eligibility for coverage may be dependent on certain criteria. Some insurance plans may require that you have a documented diagnosis of type 2 diabetes, or that you've tried and failed to respond to other diabetes medications before they will approve coverage for Ozempic. In addition to insurance, some individuals may qualify for patient assistance programs offered by Novo Nordisk, the manufacturer of Ozempic. These programs can provide the medication at a reduced cost, or even free for those who qualify. To avoid any unexpected costs, it's crucial to check with your insurance provider or a pharmacy benefits manager. They can provide you with the most accurate information regarding your coverage, any required copays, and any eligibility criteria you might need to meet. Remember, each insurance plan is unique. What's covered under one plan might not be covered under another. Don't assume that just because a friend or family member's insurance covers Ozempic, yours will too. So to sum it all up, check with your insurance provider for specific details about your coverage. It's the best way to ensure you're informed and can effectively manage your health and your finances when using Ozempic. For those looking for alternatives, there are other options. It's important to remember that each individual's needs are unique, and what works best for one person may not work as effectively for another. Let's explore some of the alternatives to Ozempic. Firstly, there are other GLP-1 receptor agonists available, such as Victoza and Bydureon. These medications work similarly to Ozempic by mimicking the action of the hormone GLP-1, which helps to regulate blood sugar levels. Secondly, oral medications like metformin or DPP-4 inhibitors can also be effective in managing type 2 diabetes. Metformin works by reducing the amount of glucose your liver produces and improving your body's response to insulin. DPP-4 inhibitors, on the other hand, work by increasing the levels of insulin your body produces after eating. In addition to these, SGLT2 inhibitors are another type of oral medication that help your kidneys remove glucose from your bloodstream, effectively lowering your blood sugar levels and potentially aiding in weight loss. Beyond medications, lifestyle modifications can play a significant role in managing type 2 diabetes and weight. A balanced diet, regular exercise, and maintaining a healthy weight are all crucial components of this approach. In some cases, these modifications alone can provide sufficient management of the condition. Lastly, there's insulin therapy. While typically used when other treatments have not provided adequate control, insulin therapy can be an effective alternative. It involves injecting insulin to help regulate blood sugar levels. It's worth noting that these alternatives are not mutually exclusive. A combination of treatments is often the best approach and can be tailored to your specific needs and lifestyle. Remember, it's always important to consult with your healthcare provider before making any changes to your treatment plan. They can provide you with the information and guidance you need to make the best decision for your health. Discussing with your healthcare provider will help identify the best option for you. Recent studies on Ozempic highlight its effectiveness. In the ever-evolving field of medical science, research is continually underway to understand the full potential of this medication. Let's delve into the latest findings and ongoing clinical trials. The STEP program, a series of international clinical trials, has provided a wealth of information regarding Ozempic's efficacy. These trials have shown Ozempic to be a strong player in the management of type 2 diabetes, with many patients experiencing significant reductions in HbA1c levels, a key marker of long-term blood sugar control. Moreover, a key highlight of the STEP trials has been the substantial weight loss observed in patients using Ozempic. In some studies, participants lost an average of 15% of their body weight over a period of 68 weeks. This is a notable achievement, considering weight management is a significant challenge for many individuals with type 2 diabetes. But the research doesn't stop there. There are ongoing clinical trials investigating Ozempic's potential in other areas. For instance, one promising trial is exploring Ozempic's role in the management of non-alcoholic steatohepatitis, a severe form of fatty liver disease often associated with type 2 diabetes. Additionally, there's an ongoing trial studying the effects of Ozempic on cardiovascular outcomes. Early results suggest that Ozempic may reduce the risk of major cardiovascular events, such as heart attack and stroke, in people with type 2 diabetes. It's important to remember that while these results are promising, they represent a snapshot of ongoing research. The full picture will become clearer as more data becomes available from these and future studies. What we do know, however, is that Ozempic is proving to be a versatile tool in the fight against type 2 diabetes and excess weight. Ongoing clinical trials are further investigating its long-term benefits and potential new applications. As we continue to understand more about Ozempic, its role in health management is likely to evolve, potentially offering new treatment pathways for patients around the world. In conclusion, Ozempic is a promising medication for managing type 2 diabetes and promoting weight loss. It's available in several strengths, administered once weekly via subcutaneous injection. While it has common side effects like gastrointestinal issues, these often decrease over time as your body adjusts. It's crucial to inform your healthcare provider about all the medications you're using, as Ozempic can interact with them. Its effectiveness can be observed within a few weeks and the effects on weight loss over several months. While it's deemed safe for long-term use, ongoing monitoring is recommended. Insurance coverage varies, so do check with your provider. Alternatives exist and should be discussed with your healthcare professional. Recent studies highlight its effectiveness, and ongoing trials are investigating its long-term benefits and potential new applications. Remember, always consult your healthcare provider before starting any new medication. Thanks for watching.